Minnesota, formerly Red Wing Dental Lab, with Gary Iocco.
Hi Dennis, thanks for coming in today.
Yeah, so I flew in from Seattle, and we are discussing how to improve their shades. And I wanted to illustrate to Gary how our shade arm works. So the way that this works is the camera attaches through a quick disconnect. So you just take this off like such, and then connect it on. And the beauty of this, Gary, is that the distance, angle, and lighting is constant. So you can almost close your eyes and take a picture. Don't try that, because you might fall over. And we have here on the front, we have a special black and white, and then 2 shade tabs. And the shade tabs are an A2 and a D3.
Dennis, can we put any shade tab in there?
You know, you can, Gary, but you don't need to. And because you can't see the nomenclature of the shade tabs, if you just leave that, then you know always the A2 is going to be on your left and the D3 on your right, and the ClearMax system will be able to color correct the pictures just like this. Okay. Now, also I want you to notice that this is slightly angled at about 22 degrees. Okay. And that way, that the reason for that is that the reflection then from the flash is on the cervical of the shade tab. And what you want to avoid, and what a lot of people make mistakes, is that they put the shade tab perpendicular to the flash. Hence, when the lab gets it, your ceramist will look at it and say, geez, I can't use this because all of the critical information is gone because there's highlights right in the middle of the shade tab. Now, a few other hints that you want to think about are, like, we're in this particular room, in the shade room, and there's a couple big windows. Now, we pulled the shades down on this one, okay? And you have to be careful about, like, so if we turn this way and the window's over here, the possible problem there is that the sunlight coming in will again cast too many highlights in the middle of the shade tab, and again, you're not going to have good information. So you want to avoid big windows like this, or pull the shades down. Now, if we were in a dental office, or if you have an operatory chair, another common mistake would be to lay the patient down. Now, what happens there, Gary, is that your overhead lights, okay, or the dental light, comes down again right on the shade tab, and again, it's blocking all the information from the highlights. So you want to avoid putting the chair down, avoid big windows. Oftentimes when we do shades, we could just do it standing up, or you can be sitting down. Okay? And we want to take 3 pictures normally for shade. Okay? And that would be 1 picture straight on, 1 picture superior looking down, and 1 picture inferior looking up. Now, the one straight on is going to show you texture and anatomy a little bit better because the highlights will pick that out. And the pictures up higher or lower are going to show the ceramic's more luster, and the shade is a little bit better. Now, to take the pictures, all we're going to do is turn the camera on, and it zooms in all on its own. Okay. Normally, we would use retractors. Okay, you certainly want to do that. And guess what? We have retractors. I didn't think we had any, but we do. Okay. All right. So Gary's going to put the retractors in. Very good. I'm going to come on over here. Okay. Again, we don't want to look at the window. Okay. Tilt your head down a little bit. Very good. And also, we want to be sure the bite isn't closed. We want to open a little bit, so that's perfect. And we're going to put the shade arm up here. And the tooth, I'm going to take a picture number 8 and click. Again, absolutely perfect. Okay. Now, let's say we want to do is lateral. Okay. And kind of move it there like that. And again, I can see the lateral in view. And take a picture. Okay. And to angle it the way that we talked about, if I go up higher looking down, take a picture. Very good. And then lower looking up. Now we take these additional pictures not so much for the ClearMatch program, but it's more for your ceramists, so that as they look at the tooth in different angles, they're able to see the character and the different, characteristics of the teeth by looking at it from different angles. Yeah. And a couple of the other ceramists I talked to, they even suggested taking 2 more pictures, one a little bit to the left, one a little bit more to the right. If you're going to err on doing too much as opposed to not enough. Okay, so those are some hints that we have about shade tape.
Thank you very much for coming out today, Dennis.
Very good.
Appreciate it.
Okay, thank you.